Thank you for coming. So today we're going to talk a little bit about the HCAHPS scores and how we can use our nursing communication to improve those scores using our communication skills and techniques that we've been taught. I know that we all are familiar with some of the tips. We're just going to go over them, and we're going to talk about why they're so important for us here at Red Bud Regional Hospital. So my name is Julie Valerius. I'm a nurse at St. Louis University, but I'm finishing up my BSN at McHenry University, and this is my final class, Leadership and Management. And I've had a really great time wandering around this hospital and learning a little bit more about this facility and everything that goes on. So let's start off. I want to give you a little bit of background first before we go into the whole focus part and the urgency of what's going on. So what is HCAHPS? What does it stand for? HCAHPS stands for Hospital Consumer Assessment of Healthcare Providers and Systems. I want you to take note of the word consumer assessment. This is something that was developed by the Centers for Medicare and Medicaid Services and the Agency for Healthcare Research and Quality. And the reason that that's important is because when we talk about getting reimbursement from Medicare and Medicaid, the HCAHPS score is based on consumer assessment, and consumer outcome is how we are being reimbursed. So it's kind of important for us to keep our HCAHPS scores up so that Medicare and Medicaid will go ahead and reimburse us. So everything we know, consumer feedback, everything is rated with stars and has reviews, and healthcare these days is just no different for us. So why, Julie, is HCAHPS important to us as nurses? And like I just said a little bit, I know we don't like to think of our patients as numbers and statistics and things like that. We're on the clinical side. We like to treat our patients, keep them safe, help them to become more healthy. But what happens is that value-based purchasing has transitioned HCAHPS from a pay-for-reporting to a pay-for-performance. So what happened is we used to get paid just for reporting that we were doing certain tests and treatments for patients, and now we're getting paid for the performance that we have and how those consumers report that we are giving them care. So it ties to reimbursement, to our quality outcomes. Quality outcomes is something that we've all heard of before. It increases the transparency of our care for customers. They do have a choice of where they want to go, and based on HCAHPS scores and reviews, they can decide where they want to go. It recognizes hospitals that are providing high quality care, so they do give some incentive payouts for quality care. And third-party payers are actually starting to follow the lead of CMS. So we have third-party, not just the Medicare and Medicaid, but now we have insurance companies that are going to start to follow their sort of requirements in order to start paying and reimbursing hospitals and healthcare systems. So this pay for quality that we're talking about is here to stay, and it's just going to get a little bit more stringent. So when we talk about these requirements, how do hospitals get these scores? They're supposed to submit a minimum of 300 of these surveys per reporting period. So what is it exactly that they survey? There's 11 categories that HCAHPS focuses on. Nursing communication, you notice, is at the top. Doctor communication, responsiveness of staff, pain management, communication about medications, discharge information, quietness at night of the hospital, cleanliness of the hospital, care transition measures, overall rating of hospital, and willingness to recommend. So this is what HCAHPS really focuses on in order to go ahead and reimburse hospitals. So nurse communication, like I said, this is the one that we're going to focus on today. So these are the 4 questions that regard nurse communication when people are asked on the survey. During this hospital stay, how often did nurses treat you with courtesy and respect? During this hospital stay, how often did nurses listen carefully to you? During this hospital stay, how often did nurses explain things in a way you could understand? And during this stay, after you pressed the call button, how often did you get help as soon as you wanted it? These questions are answered with never, sometimes, usually, or always. And we want always. So let's focus on some tips on how we can get those always answers from our consumers. So let's think about it. How do we communicate? What are some of the things that we do well here at Red Bud? What are some of the things where we can improve? And what changes can we implement in order for our patients to feel a little bit more satisfied with our communication. So AIDIT, we've all heard of AIDIT, and I think you guys even have this on your badge. So we need to use this with all of our communication. It's an acronym designed to kind of reduce anxiety and reduce stress for our patients. So of course we're talking about acknowledge them as a person, introduce who you are, tell them what you're doing, how long it's going to last, explain it in terms that they're going to be able to understand, and then don't forget to thank them. These, of course, would really play an important part on those questions where it says explaining things. That part was underlined in that one question. And also courtesy and respect. You guys know around here also that our patient population tends to be a different generation, and so we really need to focus on that as well. And that respect goes a long way for them. The next thing we're going to talk about is our bedside shift report. I've seen all of you do this. I've watched you one morning, and I think that you do well at it. And this is the SBAR. We've all heard of the SBAR. So we talk about situation, background, assessment. You know, sometimes we feel uncomfortable going into the bedside where the patient is because we're afraid of talking in front of them. It doesn't break HIPAA violations in any way, shape, or form. You are able to ask family members if they can leave if the patient doesn't feel comfortable. But in doing this situation, background, assessment, and recommendation in front of the patient, it engages them and makes them feel like they're part of their healthcare process. So situation, you know, you just walk in and say, hi, Mr. B, we're going to talk a little bit about you before we hand off a report, and let them know what's going on. What's the situation? What brought him here? What is his history and his background? You do a complete assessment from head to toe, talk about any wounds you need to talk about, and then recommendations for the day. You know, he came to us yesterday from the ED and OR. He had an open tib fib fracture, and today we're going to try and get up with PT-OT. Things like that. So what if here at Redbud we changed it from SBAR to SBARC? It's just an idea.
Great idea.
But that Q, we're getting ready to go to quorum, or we are in quorum now. So hey, there's a big Q. And Q, let's talk about some questions. And I just want you to be mindful of some of the questions that you can ask yourself after you've gone through that SBAR. So if you look on the next page, there's this addendum tool that came from corporate that they'd like you to start using as a bedside shift report. Like I said, if we just think about these questions, we can probably cut down on some of this. So does the patient have a Foley catheter? So I want to cut down on my CAUTIs. So is the necessity of the catheter reviewed? If they do have one, and you can go through all of these questions. Is the flow obstructed? Is the catheter secure? Is the bag off the floor? Does the patient have a central line? So what's the date? Do I need to change the dressing? Do I have my CHG daily bathing going on? Trace all the lines from the insertion to site to the bag. Is the patient at a high fall risk? And if they are, what kind of things are we doing? Do they have socks with the little rubber nubbies on them? Do we have everything out of the way? Do we have their bed and chair alarm activated? Do we have their call light within reach? So those are things that we go through. Pressure ulcer. Do they have, or are they at risk for a pressure ulcer, and what are we doing about that? Are we turning them Q2 like we should? Have we looked at that? Have we done the Braden scale? Is this patient post-operative? So do we need to look at the wound? We need to check for perfusion. What kind of things are going on? What kind of prophylactic DVT intervention are we doing? Is that medicinal? Do we have on our STDs? Things like that. TED hose. Are they on contact isolation? So C. diff and MRSA. And if they are we following all of the protocols and the bundles that we're supposed to do for that? So checking compliance, making sure that we have enough gowns and gloves and masks if we need it, making sure that everything is in order. And then another part of the questions I'd like you to think about is, does the patient have any questions for me before I leave my shift? And there's no better place for them to ask than in front of the outgoing nurse and the oncoming nurse. So if they have questions, that's the time where you want to know and you want to get those questions answered. And also, what questions does the handoff nurse have for me? So if we just want to add that Q onto our SBAR and take a lot more things into consideration, I think we can probably not only meet the corporate sort of thing that they have here for us, but it's also going to help us with our patient communication. Another thing I want to talk about, managing apps. So what does managing up mean? It's really just a positioning statement. So it places us, the next caregiver, our facility, our hospital, it all puts a positive light on it. So it's just talking positively about ourselves and each other. You know, this is Janet. She's been a nurse for however many years, and she's going to take really great care of you today. I'm leaving you in really great hands. So always managing up and talking in a positive light about everyone in the healthcare that we work in. So the x-ray tech, the lab, people like that. Another thing, hourly rounding, and I know that you're all familiar with this, and I'm certain that you all do this. From one staff member, whether it be the care partner or the tech or the nurse, there needs to be hourly rounding, and this is so important for us to do. So there are 8 behaviors I want us to focus on. Remember that 8 that we talked about? That's going to go ahead and reduce that anxiety when we use that sort of acronym. I want to see to make sure we accomplished our scheduled tasks. So is their antibiotic running like it should? Did I do the dressing change that I should have? Address our 3 Ps. I know it kind of sounds funny, but pain, potty, and position. What's their pain level? Do they need to be repositioned? Do they need medication for pain? And do they need to use the restroom, or do I need to empty a Foley bed? Do they need to put on the bedpan? Talk about additional comfort needs. What's the temperature in the room? Do they need fresh ice water? Environmental assessment. Just pick up little trash that's in the way, make sure that things are clean. These people are staying here, and this is where they're kind of stuck in the hospital. So let's give them a nice environment to be around. Is there anything else I can do for you before I go? Make sure that we tell them when we're going to be back so they don't just wonder if we're ever going to come back. And then go ahead and document that. I know there's a place for us to always document our hourly rounding. Engaging the patient. This one I think is probably the most important when we really want to think of our HCAHPS scores, because engaging the patient is what's really making them feel like you're there for them. So things that we can talk about with engaging the patient. How do we engage that patient? Active listening. Non-multitasking. So there's got to be a time while you're doing everything that you're doing that you take a minute, look at your patient, and kind of focus on them. So I know that it's easy for us to do 25 things at the same time, but when you take a minute to not multitask and just really engage yourself in the conversation with the patient, that's going to go a long way. Eye contact. Don't be creepy and just stare at them, but maintain correct eye contact. Your tone of voice, the appropriate speed of speech. Don't talk too quickly for some of these people, and don't talk too slow. Just because they're hard of hearing doesn't mean that you need to talk slower. The appropriate use of touch, appropriate use of humor or emotion, physical positioning. So if you have to sit or kneel, try to get on their level. Don't always feel like you're overbearing and taking over their personal space. And then the energy that you have is going to mirror the need of the patient. If they seem anxious, you need to kind of bring them down and try and put them in a comfortable place. So don't just put it passive like it's nothing important to them, because to them it is very important. So you need to go ahead and address what they have and their needs, and then go ahead and let them know that you care. What are some of the behaviors we can standardize in order to respect and engage these people? So let's just think of some things off the top of our head. We can make an effort to answer the calls within 3 rings. This is not always possible. However, if we try and say that these are going to be behaviors that we're going to try and standardize, and we're going to make this a standard, we can start to make a change. Avoid phrases like, okay, yeah, hold on, honey, and see ya. I know that I'm completely guilty of this, and I really had to do some self-reflection when I was reading over a lot of this. Ask open-ended questions such as how may I have helped you? How can I help you? What questions do you have for me? What sort of things will make you more comfortable right now? And again, that eye contact that we talked about. Oops, sorry. Patient communication boards. This is another thing that we can use when it comes to improving our nursing communication. And I know that you have communication boards in your room, and I've seen some of them, and they look pretty up to date. But what they do is they show evidence of listening for that patient. So if you keep it up to date and use it as a reference to ensure that information has been heard and needs to be addressed, that's kind of important. So if you have a patient that's hard of hearing on the right side, that's something that you can put on there that it can be passed on to the next healthcare worker. So this isn't something that everybody's fighting every single time we go in there. Or if the patient, thinks he has to keep repeating himself on a certain thing, make sure that that sort of thing is on the board. And I think we even talked a little bit about maybe making sure that every board has a marker and eraser. So that's something that that we might be looking at here at Redbud for you all. Individualized patient care. When we talk about individualized patient care, you don't have to individualize so much, but I want you to make sure that you're really acknowledging this patient when you go in there. So prepare for your visit before entering the room. Know what you're going to talk about, what kind of things you're going to address, and I'm sure you all know that already. You're like, oh, I got to go to this room because I got to do this, 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 and that. Make sure that you're using the name that your patient prefers to be called. Remove any distractions. Sometimes that's not always possible. Remove as many as you can. Start the conversation on a personal note. So you don't have to get too personal, but if you notice they're wearing a Cardinals shirt or a Blues hockey shirt and they're talking about the hockey games right now, or you saw that they have a picture hanging on the wall from their grandkid or something, that's something that you can talk about and engage them with. Make sure you recap their responses and concerns to make sure that you're both on the same page. Sit at the bedside whenever you can. Make sure that you stay on topic. Consider cultural sensitivities, and not always cultural around here, but just generational sensitivities that we really need to take into consideration here at Redbud Regional. So make sure that you think about those. Recognize the impact of the family, which is absolutely huge. You all know that your family impacts you in so many ways. That a lot of these people here, you know, they have daughters and sons that are their POAs and things like that. So there's a really big impact of that family, so you need to take that into consideration. And as hard as it might be, you need to avoid finishing their thoughts or sentences. Sometimes they might hesitate a little bit, but let's see if we can let them finish what they need to say. And finally, let's try and make some sacred time. It takes 2 minutes. You know, at your first assessment, after you finish your summit, just sit for a minute. Take a break from multitasking. Make eye contact. Use appropriate use of touch. And go ahead and make that sacred time for a second. Make them feel like they're really important. And when they ask a question, that's also another great time to make for sacred time. So, you're probably saying, Julie, thanks for all this. We already know all this. What's the point of the PowerPoint presentation? So I'm telling you this, and we're sharing this today because I want to give you some urgency of what's going on here at Redbud and with our HCAHPS scores. Last quarter, when we were still with CHS, of the 198 hospitals that were in our group, Redbud Regional fell in the bottom 10 in nursing communication. Don't take that personally. There are things that we like to take into consideration, especially our patient population, and really it boils down to their perception of our communication. So consider the population, and let's see if we can go out and improve those numbers, because we just went to quorum, and there's a new opportunity for us to just go ahead and be in the lead of the bunch. So, does anybody have any questions for me? Well, thank you very much. Thank you, thank you.
Excellent. Very good, Julie.